Hi there, Andrew with Zang Physical Therapy here, and what I want to do today is jump on and answer a few questions regarding the hip and knee that I've received over the last weeks, and these are questions from people, and the bottom line and the common thread of all of them is surgery my only option? And to that, in most cases, the answer is going to be no. But with that said, let me read these questions and give some answers. So number one that I got says, I can't cross my legs and I'm unable to squat down. The doctor says I need a hip replacement. Is there any other option? Well, my first question to you is it painful? If the answer is no, and it's just stiff, tight, you can't do something, then I would be working to try to address that. I wouldn't let a doctor cause you pain of a surgery, because that's what's going to happen if you have a hip replacement. It will be painful for a period of time before you regain your motion and your strength anyway. But in the meantime, there are plenty of hands-on stretching and joint mobilization and self-stretching that can be done to help restore and improve this range of motion such that you could cross your legs again and you may be able to squat. This is not to say that it's not going to be easy, or there might not be some discomfort along the way. But if you're willing to put in some work with someone like myself, a physical therapist, I bet you'll be able to move a little bit better and feel like you can do more. So there's my thoughts there. Question two. I started to have hip pain about a year ago, and now I have back pain as well. I've been to 2 doctors, 2 PTs, a chiropractor, nothing has helped. What can I do because my quality of life is suffering? Well, based on the fact that you've seen that many providers, you're obviously looking for some solution that doesn't involve any kind of surgical intervention, which is good. Anytime somebody has hip and back issues, you have to look at the situation of who's driving the bus. Is the hip issue that you started with, is that causing the back pain? Is it that you had some back issue that presented as hip pain and now the back is hurting? Or are they 2 distinct problems? Without knowing any more information, it's really hard for me to say which is the primary culprit. But that said, there is something to be done, and that's to get yourself at least one more set of eyes to a physical therapist that's going to look at you from a holistic standpoint, be able to assess you, and spend a lot of time with you. You know, a 30-minute evaluation, even a 40-minute evaluation, probably isn't going to be enough time to discern this. Even if they do give you an hour, that first visit, if then your follow-up you're spending 15-20 minutes with the therapist, or even if you're with an assistant, that's probably not the best way to learn how to overcome this. I'm betting that that's what you experienced in the past, which is unfortunate, but there are some of us out there who are going to give nothing but one-on-one care to patients who have these problems, and by spending more time with the individual, it helps us to figure out the number of problems involved. You know, is it the hip, is it the back, or is it both? In your case, there may very well be a little bit of both. But if you start with back pain, if I read into the question, if you start with the hip pain first for a while and then develop back, something in my gut tells me that the solution to the problem is going to lie in the hip. Be it we need to increase the mobility and motion, or whether it's increasing strength, and that may be huge for you. So if you do have more questions specifically there, by all means, send me some more information. I'm more than happy to try to fill in the pieces and guide you further. If it's not with myself, then I'll do my best to find somebody who lives close to you. All right, and number 3 says, I tore my meniscus 10 years ago and had surgery. I did great for about the first 6 to 7 years, but the last 2 to 3 years, my knee is becoming painful again, and it's becoming harder and harder to climb a ladder, because I like to do home repair type stuff and to play with my grandchildren. And I'm really not interested in knee replacement. So is there anything else that can be done? Well, it's unfortunate that your knee symptoms are coming back. And like I do with a lot of people, I have more questions before I can answer everything. But my question would be is, what kind of things have you been doing to try to help this situation? Have you been working on specific strengthening or flexibility, mobility exercise? And if the answer is no, maybe you need to get back on some of those that you did before that were helpful after your first surgery. If you don't know what's helpful, or you tried things before and they weren't helpful, then it's time to get your um, like I was saying, trying to get yourself to someone like me, and we can try to come up with a solution that will be beneficial for you in that regard. But there certainly are options that you can entertain before you walk down the knee replacement side of things, and I would always encourage that. So by all means, if you do have more questions, if you've had a past knee surgery or knee injury that's becoming more nagging, more of an issue, then let's start a conversation. Let's figure out how you can overcome that issue, so you don't need to have that knife in that knee if it can be avoided. So I hope that answered these individuals' questions. If anyone out there has any more questions, by all means, type them below or send me an email, andrew@zangpt.com. Have a nice day.